Welcome to the deep dive. Today we are wrestling with a pharmaceutical that has, well, completely redefined the medical landscape. Semaglutide. You know it as Ozempic and Wegovy.
And it's hard to overstate the impact.
It really is.
And for a bit of context, semaglutide started its life as Ozempic, a treatment for type 2 diabetes, but then we realized its potent secondary effect, significant weight reduction, and that's when Wegovy, the high-dose version, just took over weight management. And that huge, overwhelming demand, plus the supply chain issues everyone's heard about, that's precisely why this topic of alternative delivery is so crucial right now.
And that really defines our mission for this deep dive. We are analyzing the biggest game changer to hit this space since the weekly injection itself. We're talking about the new oral semaglutide formulation. We've gone through the latest clinical trial data, sifted through the prescribing info, and pulled together the key physician insights to give you a really comprehensive picture of what's coming.
It's a huge shift, moving from a once-weekly needle to a once-daily pill.
But it's so much more complicated than it sounds. Okay, let's unpack this.
It's a massive technological leap. And, we have to be clear, oral semaglutide isn't totally new.
No.
It did exist before as Rybelsus, which was mainly for type 2 diabetes. But that version, it really had its limitations.
Yeah, if you look at the data for that older pill, Rybelsus, even at its max dose of 14 milligrams, it was, well, widely considered disappointing. If your goal was serious weight loss, most physicians felt its effect was only about the same as the low-end 1 milligram dose of the weekly injection. It just wasn't packing the same punch.
It just couldn't get the right concentration in the bloodstream. That first pill couldn't sustain the high impact level you need for real weight management. But now we have the new formulation, the Wegovy tablets.
This is the one.
This is the new high-dose, once-daily pill that just got FDA approval specifically for chronic weight management.
And this is where the whole conversation just gets fascinating. The key dose here is the 25 milligram tablet. And when you look at the results from the big 64-week study, this one involved adults without type 2 diabetes, the effectiveness is right up there with the injection.
It's the aha moment for oral delivery, really. Participants on the regimen, they achieved an average weight loss of 14% of their starting body weight.
Over 64 weeks.
Right.
And that 14% figure is just a world away from the placebo group. They only saw about a 2.4% weight loss.
It's a huge difference.
To put that in real-world terms, if you start at, say, 230 pounds, a 14% loss means you're down 32 pounds. That is a clinically meaningful result from a daily pill.
And it's not just the average. If you look at the high achievers, the sources show that a remarkable 28% of adults lost 20% or more of their body weight.
20%.
20%. And that's compared to only 3% in the placebo group. So this just puts it in a completely different league than the old oral version.
That efficacy is phenomenal, but hang on, why did they settle on 25 milligrams? I saw that a 50 milligram dose was also tested. Why not go with the higher one?
And that is the crucial detail. It's why one expert called the 25 milligram dose the Goldilocks option.
The Goldilocks option, okay.
Yeah, because while the 50 milligram dose did get, maybe fractionally better weight loss, it came with a much, much higher rate of side effects.
Mostly the GI stuff.
Exactly, the gastrointestinal upset. So they realized they could get almost the same incredible result, but with way better tolerability, just by cutting the dose in half.
Making 25 milligrams the sweet spot, the perfect balance of high efficacy and, patient comfort.
Precisely. And the clinical reason it works so well all comes down to concentration. The 25 milligram tablet gets a steady state concentration in the blood of about 77 nanomoles per liter.
Which is good.
It's predicted to be virtually identical to the concentration you get from the most effective 2.4 milligram weekly injection dose. That one's around 75 nanomoles per liter.
So they did it. They basically duplicated the injection's power in a pill.
They did.
Here's where it gets really interesting, though, because achieving that concentration with a pill is, like you said, a technical marvel. But its effectiveness hinges entirely on the user, on you, acting as your own specialized delivery system.
That's the trade-off, absolutely. This is not like taking a daily vitamin. This pill demands meticulous, absolute adherence to a very specific routine.
Why? What's so special about it?
Well, the semaglutide molecule itself is large, it's fragile, it should be destroyed by stomach acid, but it relies on a chemical absorption enhancer to survive.
An enhancer called salcaprosate sodium, or SNAC.
SNAC, yeah. And that sounds like the real secret weapon here.
Tell us about it.
Okay, so think of SNAC as a kind of temporary chemical shield. The semaglutide molecule is so big and sensitive, stomach acid would just obliterate it instantly. SNAC creates this protective, localized microenvironment right there in the stomach. It shields the drug just long enough for a small percentage of it to sneak across the stomach lining into the bloodstream.
Before the environment changes.
Exactly.
And because that whole process depends on the stomach being perfectly empty and chemically stable, the prescribing information lays out a non-negotiable daily protocol. This is crucial for anyone considering this.
There are 3 critical rules, and you have to follow them every single morning. You cannot deviate.
Okay, rule 1.
Rule 1, you must take 1 tablet daily on an empty stomach. First thing in the morning is best when the stomach is most stable.
And rule 2 is about what you take it with. It's not just a glass of water.
No, absolutely not. You can only use a very small sip of water. The instructions say up to 4 ounces max.
Just to get it down.
Right. And you absolutely cannot take it with coffee or juice or anything else. Those liquids will completely disrupt the chemical environment that SNAC needs to work.
And the third rule sounds like the most demanding one. It's the waiting game.
It is. You have to wait a minimum of 30 minutes, and preferably even longer, maybe up to an hour before you eat, drink anything else, or take any other oral medications.
That 30-minute window is make or break.
It's the critical time for the SNAC to do its job and push the semaglutide into your system.
So what happens if you mess up that morning routine? You gulp it down with your coffee, or you only wait 15 minutes because you're in a rush.
If you deviate, the sources are very clear.
Yeah.
You've basically just negated the entire delivery system.
Wow.
It's like trying to launch a satellite without the booster rocket. The drug just dissolves in your stomach acid, and barely any of the active ingredient actually gets absorbed. That 14% average weight loss just vanishes.
And that adherence requirement also explains a very specific warning we saw about trying to sort of self-dose.
Right.
A user might think, oh, I'll just take 2 of the older 14-milligram Rybelsus pills to get close to 25.
And that is explicitly warned against. Trying a DIY upgrade like that completely cancels out the technology. The Rybelsus formulation and its SNAC aren't designed to handle that dose all at once.
So you're just wasting money on pills that won't be absorbed.
Pretty much.
So moving beyond just weight loss, it's really clear that the role of semaglutide, both injection and oral, is expanding. It's moving into other therapeutic areas now.
Absolutely. The FDA indications are much broader now. For adults, both the injection and the new tablet are now indicated to reduce the risk of major cardiovascular events.
So we're talking about things like CV death, heart attack, stroke.
Exactly. In patients who have established cardiovascular disease and are also living with obesity or are overweight, that's a huge benefit that goes way beyond just aesthetics.
And for the injection form, it goes even further, right? Into liver health, pediatrics.
It does. The injection is also approved for treating a type of liver disease, MSH, it used to be called NAIR-SH, with moderate to advanced liver fibrosis. And really critically, the injection is approved for weight management in pediatric patients, so kids age 12 and older. The oral tablet doesn't cover that group yet.
Which brings us to the necessary counterweight to all this efficacy. We have to talk about the safety profile, and specifically the most serious warnings.
This is the boxed warning, and it's critical to understand. In rodent studies, semaglutide caused dose-dependent thyroid C-cell tumors, including cancer.
Okay, that sounds serious.
It is. Now, while the relevance to humans hasn't been definitively proven, the risk is serious enough that the drug is strictly contraindicated, meaning you cannot take it if you or your family have a history of medullary thyroid carcinoma, or MTC.
Or another rare condition.
Or a rare endocrine condition called multiple endocrine neoplasia syndrome type 2, or MNN2. That will be the very first thing a doctor asks you about.
Looking at the full list of serious adverse reactions, what else should people really be aware of?
The list is, it's unfortunately diverse. It includes some potentially life-threatening conditions. Acute pancreatitis is a known risk. Gallbladder problems, including gallstones, are also reported pretty often.
But you said the thing to really emphasize is the link between the GI side effects and kidney problems.
Yes.
How does a weight loss pill lead to kidney injury?
It's indirect, but can be dangerous. The severe GI side effects, we're talking intense nausea, vomiting, diarrhea, that can lead to rapid, profound dehydration.
Oh.
And if the patient doesn't rehydrate properly, that severe dehydration can precipitate an acute kidney injury. We need to be clear. This isn't just minor upset stomach. It can be serious enough to land someone in the ER.
I also saw a very specific warning related to surgery and general anesthesia. That might surprise people.
Yeah, it speaks directly to how the drug works by slowing down digestion. Semaglutide significantly delays gastric emptying.
Food just stays in your stomach longer.
Much longer. So if a patient needs general anesthesia or deep sedation for a procedure, that delay dramatically increases the risk of pulmonary aspiration.
Where stomach contents come back up and are inhaled into the lungs.
Correct. Which is very dangerous.
Yeah.
So you have to tell your providers you're on this medication well in advance of any planned procedure.
Let's talk about the lived experience of this then. We've established the effectiveness, but these side effects, how common are the GI issues really, especially with the daily pill?
They are exceedingly common. In the trials for the injection, up to 44% of patients reported nausea.
Wow, almost half.
And for the clinical trial of this new 25 milligram oral tablet, a massive 74% of participants reported some kind of GI side effect. It's an accepted part of the therapy, especially when you're starting out and raising the dose.
And I imagine combining those side effects with that super strict morning routine must be incredibly difficult for some people.
It adds a whole other layer of complexity for sure. We saw some anecdotal reports that for some patients, just sitting through that mandatory 30-minute fast
With just a sip of water.
with just a tiny sip of water, yeah. That alone causes major gastric upset before they've even had their first meal. The daily ritual itself can become a source of discomfort.
Finally, we have to touch on this growing debate among physicians about the quality of the weight loss. We're talking about muscle mass loss. It wasn't the main concern initially, but it seems to be gaining traction in the conversation.
Yes, this viewpoint is definitely gaining traction. And to be fair, semaglutide does cause a greater proportion of fat mass loss than lean mass loss. But physicians are still raising concerns.
What's the specific concern?
So one doctor we looked at argues that the rapid and potent appetite suppression can induce a type of starvation weight loss.
Starvation weight loss.
Right. So while you are losing fat, the worry is that you may also be losing muscle mass at a higher rate than if you achieve that weight loss through, controlled diet and exercise.
And for some patients, especially older patients, that rapid muscle loss could be really serious.
Precisely. That loss of lean mass can negatively impact your long-term metabolic health, maybe decrease immune function, bone density, overall longevity. Another doctor we saw explicitly flagged muscle wasting as a new problem being found out with Ozempic. The clear takeaway is that this kind of powerful weight loss really needs careful, comprehensive medical supervision.
Including diet and exercise guidance to try and mitigate that muscle loss.
You have to.
So what does this all mean? We've seen that the new high-dose oral semaglutide is a true technological marvel. It offers effectiveness comparable to the highest dose injection. Plus, you get these powerful cardiometabolic risk reduction benefits.
The benefits are undeniable, absolutely, but they come with a significant cost, both in complexity and in risk management. You have a complex safety profile, that boxed warning about thyroid cancer.
And the high rate of GI risks that can cascade into serious things like kidney injury. And then there's the pill itself, which demands this absolute daily, highly precise adherence to a fasting routine just to be absorbed.
It sounds like a commitment you have to take as seriously as the drug's risks.
It is. The effectiveness of the 25 milligram oral tablet makes it a complete game changer, especially for anyone with a fear of needles. But you trade that benefit for a rigorous daily commitment. A small sip of water, a 30-minute minimum wait first thing every single morning without fail. It turns the once-a-day pill into this demanding mental exercise of routine. It requires perfect discipline.
So the ultimate question for you, the learner, is really one of compliance and sustainability. You're balancing two very different kinds of burdens here. Do you prefer the simplicity of a once-weekly injection where you deal with the psychological hurdle of a needle just one time a week? Or do you prefer eliminating the needle entirely, but signing up for this rigorous, non-negotiable daily commitment?